Scrubbing should never be done on the face. The pace that the world is going on, 9 out of 10 female has PCOD. And as soon as I got pregnant, loads and loads of acne all over my face. You can apply it on your face and use it as a cleansing oil. It's gonna melt away your makeup. In Vadodara specifically, if you are talking about, then sunscreen. Body, there are chances of having cancer in that region. Everybody is different, every body is different, and every body is well appreciated.
गणपति बाप्पा मोरया. Hi everyone, this is Hinal Panchal and welcome to the talk show Extreme Gratitude. The talk show where we invite people who are extremely passionate about something or are constantly contributing in doing so. With that intention, our today's guest is a cosmetic physician, Dr. Ghosha. The conversation will be full of knowledge, tips and tricks, do's and don'ts, preventions and cure, some treatments and threats, and of course, some points about food and lifestyle. So let's welcome Dr. Ghosha. Hi, doctor. Thank you for joining in and accepting our invitation.
The pleasure is all mine.
So how are you?
I'm good, how are you?
I'm good. How is your motherhood going?
Treating me well. It has its own ups and downs, but then overall it's a joyous ride.
Yeah, I also wanted to know, as you have become a mother now, so how do you deal with your skin? Because I have heard that there are so many changes after you become a mother, even with the skin, your body. So how you as a doctor are you dealing with that?
Yeah. So to start with, I had this touch wood. Luckily, I'm genetically blessed, and I had this flawless skin.
Yeah.
I never had an acne, or maybe one or two here and there is fine. That's a routine for everybody.
Yeah.
But apart from that, no acne. And
Okay.
as soon as I got pregnant, because of my hormonal changes, I started having acne, loads and loads of acne all over my face.
Yeah.
And then sadly during pregnancy, you can't do much about it.
Yeah.
So for most of them during pregnancy, all those people who have bad skin, they in fact are blessed with a beautiful skin. But when I got pregnant, I had a flawless skin and it got bad. So it was a little, not traumatizing,
Yeah.
but then something that you are not happy with at that point of time, right? So
True.
it was that, but then luckily with all the few ingredients that I can apply during pregnancy, it was taken care of. It was at least manageable.
Yeah.
And then post-pregnancy, I could start doing certain treatments and which helped me recover my skin.
Okay.
But still, I was feeding my baby till November, December.
Right.
So again, then once I stopped feeding again, there's a change in your hormones.
Yeah.
Your prolactin hormones decreases. So again, I had an eruption of acne, but then I took care of it. So it is fine now.
Yeah, nice. So now as this show is about gratitude, so name 3 things of people you are grateful about.
So talk about gratitude. I can't say 3 things per se that I'm grateful towards.
One though I know.
Of course, my child
Yes.
is on the list, number 1. But then, I'm a spiritual person, and
Right.
I strongly believe that, you have come to this earth not just for, it's not just a one-time thing that you come, you enjoy, and you die, and we'll see later. You have come on earth for some purpose.
Yes, right.
There's some higher God, there's a higher spirit which connects everything. There's law of karma, there's everything, and believe me, a soul's journey is like you travel, you get separated from the almighty God or
Yeah.
whatever somebody has their beliefs on. You get separated, you go through your learning phases, and then at the end you get back to him.
Yeah.
That's nirvana that you see,
Yeah.
right? So I'm grateful that I even am aware of this thing.
Yes.
Because in today's generation, people are not even aware of this thing.
True.
And I don't know what kind of karmic cycles they'll be building. I don't know how much they'll have to suffer or what all they'll have to go through to even come to this point to even understand or acknowledge or know this thing that and then even once you know, there's a long way that you can go.
Yes,
but then
yes.
at least I'm grateful starting that at least I'm aware that this is something that is what true life is. And then I'm grateful for having the best parents, a best guru who could, get me
Guide
on this
you.
track, guide me
Yes.
over here. So I'm first and foremost grateful for this. Of course, my parents, my brother, my husband, my child, everything I'm grateful about.
Yeah, right.
So first and foremost this, and I think in this everything, everybody and everything is a part of this. So
Yeah, it's a
I'm-
process.
Yeah, so I'm
Yeah.
grateful for all those living beings and everything that is a part of me for this journey.
How nice. Okay, so I would start with basics.
Yeah.
What do you think is a root cause of acne? Like, is it atmosphere? Is it pollution? Is it stress? Is it what it is? Like, what's the root cause?
For acne, there are multiple root causes. There's not one thing that you can pinpoint that this is the only thing that causes acne.
Okay.
Okay. Acne runs, and you have named most of it. Like all of that things together and individually leads to acne.
Yes.
That is the food that you eat, the lifestyle that you have, the hormonal changes, the stress, the pollution, the water, and genetically also.
Right.
All these things contribute for causing acne.
Right. I've also heard that, your hair, your nails, your skin is is a parameter to judge your health. Like, it tells a lot about your
Yes,
health.
it does, because skin is the largest organ of your body.
True.
Skin is the organ that is protecting all other organs of your body.
Yeah.
So each cell of your body, each DNA has the same thing of your body. You can pick one DNA and you can tell everything about that person. Similar, skin is your organ. So based on your skin's health,
right.
you can tell.
Yeah.
So if you are eating nutrients enough, it will be seen on your skin. So you are getting nutrients enough. Your gut health can be told by your skin and hair.
Yes, right. Even genetics plays a role, right?
They do. Genetics also play a role in it, of course. But as you said, like what we eat is always shown on our skin.
Yes, right. And what do you think about hormones? Like nowadays, as I personally, I am dealing with hormonal changes, and because of that, my skin is getting affected a lot.
Yes.
Right. So, what is your take? Like, what do you think? How does hormone takes a role on your skin?
How does hormone takes role in the skin is? See, again, when we are talking about a female, most of the females, like when you see in today's world and the pace that the world is going on,
Right.
9 out of 10 female has PCOD.
True.
I've seen 9 out of 10 female has PCOD. I would not say 10 out of 100, but yeah, I can say that 10 out of 100 females who are pregnant, 10 out of them, they have got pregnant through some sort of medication. I'm not saying just IVF or something like
Yes,
that,
yes,
but
I get
through
it.
some medication, with some medical help.
Health.
Yeah, they have got pregnant. So why do you need that? Because your hormones, there's something not working correctly inside your system, and when something is given from outside,
Right.
it is going to affect your body.
True.
Now, my take on how your hormones affect your skin is, I can tell you a list of things that if you have PCOD or if you have hormonal imbalance, first and foremost, you'll start seeing acne in the lower 1/3 of your face. Then you'll have thick hair coming on your chin area, upper lip area, around your nipples, on your navel line. Your underarm and groin region becomes darker. Your scalp gets oily, your hair gets frizzy. You start having ingrowth of hair after waxing or shaving.
True.
So these are all these things you can see on skin if you have an hormonal imbalance or hormonal disruption.
Right, right. And how does it affect men? Like, as we are talking about women who have
So for
PCOS.
men don't, most of the men don't have to go through, they don't have progesterone, estrogen, so the effects of they do have, but not at the level that we have. So they don't have a hormonal cycle that we have. We have a hormone cycle that changes every month.
Yeah.
For them, they have a stagnant thing going on.
Okay.
For them, what affects is this testosterone. When the testosterone level increases, you'll see a lot of men getting bald, young, they're getting bald.
Yeah.
Because their stress is increasing, their testosterone is increasing, and they're getting bald.
I've heard that it's because of genetics, isn't it? Like also.
It is genetics, but let's say if you're saying that it's genetics, are their father bald? Are their father's father bald? Genetics is only like 1% or 2% of people getting bald in an early age. But right now, if you take, I mean, when I was in college, I would see like when people were doing their post-graduation, the postgraduates, the residents, I think 5 out of 10 would have a receding hairline and 1 or 2 would be like half bald. So
Right.
that cannot be genetic. That is because of the stress that is caused in the body. That is because of the food that we are eating, not nutrient enough, causing stress to the body. So the what you eat also causes stress in
Yeah,
the body.
that's my next question. Like, how do you think smoking and drinking? Because nowadays,
Smoking and drinking,
It's-
that's again a lifestyle that causes stress in your body. So smoking and drinking both dehydrates your body.
right?
Yeah. So for most of the smokers, you will see they have a very dry and rough skin,
Yeah.
chapped lips,
Acne's are at its peak.
acne. Yes. So that
Yeah.
is how.
And-
the nicotine is very bad. It will not let the nutrients get absorbed inside your body that it should be. Your
Yeah.
body will not, because your lungs will be weak. Your body will not be getting enough oxygenated blood.
Right. Yeah, I think, and nowadays, because I know I am a young adult, it's so much that every second person is smoking, every second person is consuming this, and not to a limit.
Yeah.
It's way too much.
So that is something that needs to be changed in a mentality mindset of the young generation. It has too much of Western influence has come
See,
over
yes.
here, and people have been 17 years, 18 years people going around and smoking weed, and that is absolutely normal.
Yeah, absolutely.
So-
They are just normalizing it.
Yes,
Like,
so
it's fun.
There's something we need to change on a moral grounds rather than on moral grounds also. I mean, they don't even know how damaging that is to their body. So
Yeah, I also think that the first thing that comes is educating yourself first. Like, it's a yes, do parents do hold their responsibility. But what if ये नहीं करी शक्या? मतलब to an
yeah,
extent.
and then nahi kari shakya karta, but rather I feel that today's generation, there's a chain, okay? So when the child is young, when it's a baby, till 7 years, 8 years, 10 years, their role model is their parents.
Right.
They'll mimic their parents. Once they are 10 years, 12 years, as they get teenage, their role models are their friends.
True.
They'll mimic their friends.
True.
Once they are out in the world, once they are 20, 22, their role
Yeah.
models are their love partners.
Yeah, true.
Okay. So this cycle. When they are in those teenagers and early 20s, they are too much into peer pressure.
Yeah.
They are too much into who cares. I
Yeah.
want to live my life, and then the trend that is going on at that period.
True.
So all that is influencing. Parents would tell them not to do that. Parents would have educated them too much, but then they have a fear of missing out, losing on their friends. So because of that, they end up doing that, even when they know from the bottom of their heart that it is not right.
It's
but
damaging
because
you, yeah.
to be in the image of being cool or not losing the friend, they end up doing that.
That's true. That's so true. And it's a, I can't even explain, it's so worst. Now, we'll switch a bit.
Sure.
I would ask that as summer is coming,
Yes.
what is your advice for the skincare? Like,
In summers, in Vadodara specifically, if you are talking about, then sunscreen. I cannot, focus less on sunscreen. The heat is too much. It is too much damaging to your
My
skin.
God, yes.
So sunscreen is something that you are supposed to use. Drinking plenty of fluids. Water, fluids, any sort of water best, but then also water is not enough in this heat. You need electrolytes, you need fruits, you need everything. Drinking plenty of fluids is important.
yeah,
So these are the-
electrolytes as in coconut water counts.
coconut water you can take. You can also have vitamin C, so you can have lemon water with salt and pinch of salt and pinch of sugar or honey, whatever you add. That's again an electrolyte, so that works best during
Yeah.
summers.
That's right.
So,
Okay, so I would ask that as I, like, if I talk about myself,
Yeah.
I apply makeup very frequently,
okay.
right? So now I can't run, like, હું એનાથી ભાગી નહીં શકતી.
Yes, because you're in a profession
Yeah,
in which
I
you're
am in a
supposed to
profession
apply.
where I
Yes.
should. So I've come across this thing कि beauty blender you should just discard it after using once. So you use disposable beauty blenders.
Yes.
So what's your how do you think makeup harms your skin, or does it doesn't make any impact?
So, I think your question is that whether you should be applying makeup or not,
Yes.
whether it is healthy for the skin or
Yes.
not, and if you are in a field or if you are supposed to be applying it every day, then how you should be applying it, what all things you should be taking care of. Alright, to start with, makeup does harm your skin or no? It does not actually harm your skin if you are using the right products in a proper way and protecting your skin enough.
Right.
Okay, so you need to hydrate your skin before applying moisturizer, before applying makeup.
Yes.
Hydrate it well.
Yes.
And use a primer or a good thick moisturizer.
Right.
Okay, so that will form like a film over your skin.
Right.
So that it will not let the harmful chemicals of the makeup affect the skin.
Right.
Okay, then second is you should be taking it off. Like at night, make sure you take it off completely off your skin so that
Yes.
your skin can breathe. Again, while taking it off, you have to be careful not to rub your skin, not damage your skin, not irritate your skin. Okay.
Right.
You remove it in a proper way. Use micellar water, they works best. If your skin is not oily, you can also use the balms and oils, the cleansing
Yeah.
oils. They
Yeah.
works wonderfully for your skin. If
True.
you are someone with who has an oily skin and on using balm or cleansing oil, it breaks out your skin. What you can use is a moisturizer, a good old Nivea cream.
Yeah.
You can apply it on your face and use it as a cleansing oil. It's gonna melt away your makeup.
Oh, is it?
Yes,
Wow.
it will. And then add micellar water on your cotton pads. Use a organic soft cotton pad. Then wipe it with it 2 to 3 times, as much
Yeah.
as it takes to clean. You should be cleaning off the makeup till your cotton pads turn out clean.
Yeah.
Till then you should be, keep on wiping it off, taking it off.
Yeah.
So that is how you clean your face. So apply
Right.
it with a protection, and when you remove, you make sure you remove everything out of your skin.
Yeah.
Alright.
True.
Then hydrate your skin at night also before
Yeah.
going to bed. You use that. Talking about the makeup brush and blenders. Blenders, I think it is too much of a bio waste if you are just using it once and throwing.
Okay.
Right.
Okay.
So, and does not make sense just use it once and throw it. Why to throw it? It's applied on your skin. You are the one who are using it. Make sure that you use it, you wash it frequently. Once a week, make sure that you are washing it off, clearly washing it off,
Okay.
There's a proper technique. Now that's altogether a different thing.
Yeah.
But you know how to wash it off. And if you don't want to use beauty blenders, then brush. There are brush now to blend the makeup. You use that, and then brush is also supposed to be cleaned properly.
Yeah.
So if you take proper precautions in it, makeup would not damage your skin.
Okay, so talking about summer, you can use sunscreen, but then we got
Sunscreen.
to makeup.
Yes.
Proper beauty blenders, wash it properly,
Yes.
have good makeup,
Yes.
good quality makeup.
Good quality makeup and the makeup that suits your skin.
That's also true. Yeah.
So that is
Okay.
something to be taken.
Now you might be coming across many young people like as patients who want to undergo cosmetic treatment. And there's also constant pressure of looking good because of this time, this era.
Yes.
We have this Instagram influence, we have this, that, and this, and everything, So, what is your take? Like, how do you deal with patients? Yes, of course, they want to undergo a treatment, a cosmetic surgery, or whatever. It's. I don't know those terms, but yeah. So, how do you deal with that pressure? Like, how do you
How
advise?
do I deal with the pressure?
How do you deal to calm that patient down? Because there are times when you are so conscious about how you look, right?
Okay, so there are two things over here.
Yeah.
When you ask me how do I calm the patient, again, one of the things that I'm grateful for, that I have a strong ethic and I follow the ethical practice. But most of the doctors, they don't follow ethical practice.
Okay.
Those are the crowd that they want.
Yeah.
So I read this piece in a journal last year. There was this some 17-year-old female
Yeah.
who had come to the doctor saying that a plastic surgeon and a cosmetologist. He was practicing cosmetology and plastic surgery. He was plastic surgeon saying that, I want to go for a bariatric surgery. So that is when, you tie your stomach in half so that you'll eat less and you'll be thin.
What's that name? What's the term?
Bariatric surgery.
Oh.
So she was like, the doctor said no to her, that you are too young, you are just 17.
Exactly.
Just do some exercise. You are not even, you are not even overweight or something. You are just little healthy, on a healthier side. Do exercise, follow this routine and you will be okay.
Yeah.
Few months down the line, she comes back to the doctor. And then when the doctor looked at her, she looked so parched. She had lost half of her hair. She had lost so much of weight. And doctor said, what happened? What is your concern? Her skin had gone for a toss. Like doctor had gone, once you said no, I went to the other doctor and performed the surgery.
My God.
And now I'm losing my health. What can I do to undo that surgery?
Yeah, that's my point. Yeah, that's my
point.
point.
So half of the times the surgery is undoable, half of the time it is not undoable.
Okay.
Sadly, that surgery was not undoable. And the doctor was so sad.
Okay.
That had I been, so that is what the piece in the journal was, that had I been how could I have stopped this, and how could I stop the world? If I say no, somebody else does it.
Right.
How to stop, how to educate the generation that not to go for this.
True.
So right now, there are two questions. One, people being too much conscious about their looks, and at the same time the unethical practice being performed, the ones who are surviving on those. There are two things, not just one thing. And I feel that the people might want, see, as a parent, your kid would ask n number of things from you. But
True.
as a parent, you should know what to do, what not to do, right? Same way, I think doctors have to be ethically right. Your patients would come and ask you anything, but you have to tell them no.
Right, yeah.
But that sadly has not been practiced.
Yeah,
You've seen so many upstanding clinics, so many renowned clinics, malpractices happen.
Yeah, that's sad.
Now going back to that how do I deal with it? So you can just counsel the patient, but you can't really do anything about it.
That's also true.
If you come to me saying that, doctor, this particular part of my body is not okay, or I want to rectify this thing about me, then I would tell you that it's okay, it's just that much, you'll get out of it, or this is okay. But then if you want to do it, who am I to stop you?
Exactly, you can't force them to not do. Yeah.
So I have to give them, and if you have come to me with some query, I have to give you the options that are available.
True.
So I'll give the patients the options, and I'll also counsel them that whether it is needed or not needed. I'll give them my point of view, but then I have to leave the rest on them.
That's true. That's true.
I do my part and let the patient decide what they want for themselves.
That's true. And also, as we were discussing about acne, there are so many multiple options available to treat acne, as in instantly, right? There are ointments, there are pimple patches.
Yeah, ointments don't actually, spot treatments kind of, yes. So
okay, so what do you think is a liable option, like
for treatment of acne?
Yeah, for example, I'm having a shoot tomorrow and I just come up with a pimple which might show up, and I'm just conscious about it. I want to get rid of it.
So as we discussed, two things. Pimple patches is there, something that you apply and leave it overnight. It subsides the acne a lot. The second is a spot treatment. There are different creams available in the market as a spot treatment, so in which you just apply it on the acne, you leave that. Then there's another option of an injection.
Okay.
Corticosteroids. So if you have a big acne, I'm just not talking about the small zits, I'm talking about a big acne you have, and you have a shoot tomorrow or day after tomorrow. Then those corticosteroid injections, which we inject on the acne, at the site of acne, it takes away the inflammation and it heals the acne.
But uske liye you have to consult a doctor.
Yeah, you have to go to a doctor. You
Yeah,
have to
that's
go to a dermat, or you have to go to a cosmetologist.
Okay, right. Okay, so what are some prevention tips that you can give for blackheads and pigmentations?
Blackheads and pigmentation?
Yeah.
They're two different things.
Okay, well.
Okay.
Yeah.
Yeah. Blackheads and whiteheads, everybody is going to have. Okay.
Okay.
What is blackheads, whiteheads? They are opening of your oil glands.
Right.
Okay. The blackheads that you see are the open pores. The whiteheads that you see are closed pores.
Okay.
you might think the otherwise, that the closed one should be black and the open one should be white. No, the ones that are open, so when there is oil, the pollution and dirt gets accumulated over it, hence they appear black. The ones that are closed, they stay white. Okay. So to prevent blackheads, whiteheads, what you're supposed to do is you use salicylic acid based toner or a serum, applied at least 2 to 3 times a week.
Right.
And whenever you are washing your face, make sure wash your T-zone area properly, cleanse it properly. You should be following 60 seconds face washing rule, because people just like washed off.
Yeah.
You are not cleaning your skin properly. You should be like making sure that you are covering every part of your
That too
skin
gently.
not
Just
rubbing your face.
scrubbing it out.
Yeah. Scrubbing should never be done on the face.
Yes.
I've seen a lot of people, a lot of patients coming up to me and saying, "Doctor, we are using scrub and still we have blackheads, whiteheads." No, you are not supposed to use scrubs on the face. Okay.
Right.
So salicylic acid based toners, serums, niacinamide based serums you can use on your face to control your oil production.
Right.
So that will prevent your blackheads and whiteheads, and going for a regular cleanups.
Okay.
So once a month you should go and get it cleaned properly.
Yeah.
So that is how it will be.
Yeah. As you mentioned, scrubbing, and I'll add bleaching also.
Yes.
So now it counts in the salon treatments that we have. Some people mention that salon के ऊपर लिखा होता है कि cosmetologist.
Yes.
So what do you want to say about it? Like, because I am aware that a cosmetologist or a cosmetic physician is different from a salon cosmetologist.
Yes. So I'll very funnily you brought this thing up. So very recently we saw an ad, I'm talking about Vadodara, of some ex-salon. Say they have got a laser machine. Okay. Now laser treatment would seem very technical, like you just take the machine and move in a proper way and the laser is done. It seems from a layman's point of view.
Yeah, true.
But that is not that. Laser has its own, you cannot just do, it has its own physics behind it. You are supposed to use it at a proper frequency, at a proper energy.
True.
All that is based on your skin type, your hair thickness.
True.
Everything is based on that. Based on that, you decide what kind of energy to be given, at what speed to be done, at what frequency to be done.
Yeah.
All those things have to be calculated.
True.
Okay. For you only, the energy for your face and the energy for your hands would be different. For your energy for your legs would be different.
Absolutely true.
Now, who would understand all these things? For this, you need to understand the skin. For this, you need to understand hair. For this, you need to understand physics of the machine.
Yeah.
Okay. Do you think somebody who owns a salon knows all these things? Do you think somebody, the salon person, while buying the machine, they would have been taught all these things?
Of course not.
Of course not. And then they call themselves doctors. A friend of mine did call that salon saying that, I want to take a consultation with the doctor, and the salon owner, whom we know is not a doctor, claims herself to be a doctor and says, yes, I am the doctor.
Oh. I forgot to ask you, what's the difference between a dermatologist, a cosmetologist, and a cosmetic physician?
Okay. So cosmetologist is again a widely used term. Anybody who is in performing a cosmetology procedure can be called cosmetologist.
Right.
But as we just discussed, that even the salon people are calling themselves a cosmetologist. A new term was coined as a cosmetic physician. So you can make out a difference between a doctor who's practicing cosmetology and then a salon people or a non-medico who's performing a cosmetology.
Right. Yeah.
So these are the two terms coined because of that. And dermatology is somebody who has studied skins in depth, and they have done masters in dermat section, and they can treat the illness part of the skin and everything. They would know the fungal infection, the bacterial infection, the viral infection and everything.
Yeah.
Whereas a cosmetic physician would not know that about their skin.
Right.
I am a cosmetic physician, so I am dealing with the beautifying part of the skin,
Right.
not the illness part of the skin.
Okay, so I really wanted to know that how do you identify your skin type, because I'm still in delusion what my skin type is. That's my personal question.
So there's a very simple experiment or a test you can do at home to know your skin type. You wash your face.
Right.
Leave it for 5 minutes. If
Yeah.
your skin feels parched, then you have a dry skin.
Washed with just
Face wash.
water?
No,
Okay.
with face wash. You're
Then
supposed to
how
use
would you
a
know?
gentle face wash? Everybody's supposed to use a gentle face wash.
Okay.
Okay. So when you wash it with a gentle face wash.
Okay.
Because with water you're not removing everything, right?
Yes.
So use a gentle face wash. Wash your face and leave it there for 5 minutes. If your skin feels parched, then you have a dry skin.
Okay.
Okay. If your skin feels oily in 1 hour, then you have an oily skin. If your skin feels normal, then you have a normal skin.
Okay.
Certain part of your area feels more oily compared to rest, or certain areas feel dry, then you have a combination skin.
Yeah. Then I have the same. My T-zone is too oily.
For most of people do have a combination skin because the T-zone area is oily, and the rest is either dry or normal.
Okay. Okay, I asked about face wash because એવું હોય છે ને કે there are different
Face wash based on your skin type.
normal to oily, oily
Yes.
to
Yeah, so
on.
normal to oily ones, they usually have salicylic acid or benzoyl peroxide in it to control the oiliness of your
Yes.
skin. That is there.
That's
But you
a
can
normal
use-
one.
Yeah, and when even though whatever skin type you have, you should be using a gentle face wash and then using a right products for that, because when you, even if you have an oily skin and if you use harsh face wash, it's gonna strip off even the healthy oil of your skin. When you strip off the and all, like you strip your skin off the oil, it will lead to more oil production.
Oh,
Okay.
right. And
So,
that would cause
lead
acne.
to more, that will cause to more acne, more oiliness of your skin.
Okay.
So you should always be using a gentle face wash. Here's my secret. What I use as a face wash is a baby shampoo.
Wow. Is it?
Yeah, I
Which
use baby
one?
shampoo. I use like couple of them. I use Johnson & Johnson, and sometimes I use a Spoo shampoo. There's this SPOO Spoo shampoo. That's what I use as a face wash.
Okay.
Two things. Shampoos are meant to take away the excess oil from baby's hair, and they are very gentle. If they are gentle for baby's skin, they are gentle for you. So it cleanses my skin, at the same time it does not strip off the good oils from my skin. So I use baby shampoo as my face wash since forever.
Okay. Not because you have become a mother.
Yeah, no. Since forever. I've been using
Okay.
that.
Since we are talking about treatments and all, what is HydraFacial? Like, I really want to know.
HydraFacial. So there's this machine
Okay.
as HydraFacial. So it has multiple probes in it. Okay. So it starts from cleansing your skin, and there's this ultrasonic scrubber that comes along with it. Then there's an oxygen supply. So when you blast 99% oxygenated air on your face, so your skin breathes better. Then there is electroporation probe in it. Then there's a tightening probe in it. So it's a multi-procedure treatment.
Okay. And it differs from skin to skin, or it?
No, it does not differ. HydraFacial suits every skin.
Okay.
Yeah, and of course the serums that you use in it, and see, HydraFacial is not one treatment. I mean, you cannot say a HydraFacial done at my clinic is different than a HydraFacial done on somebody else's place, and HydraFacial done in salon is absolutely a different thing.
Yeah.
And the parlor wala auntie that comes at home does also HydraFacial, which is altogether a different thing.
Yeah.
So, but then HydraFacial basic, the common thing everywhere is that a proper hydration is given, all the impurities are sucked out of your skin.
Okay. Do you have any sister, what we called, different treatments just like HydraFacial? Do we have other treatments also for the glow of the face or for
Yes,
the?
we do have multiple treatments. So HydraFacial is a medifacial. So in medifacial at my place, at my clinic, if you talk about, I have K-Glow facial, I have Celeb Red Carpet facial, I have BB Glow facial. Multiple treatments are there.
Okay.
Now that is again a combination. What is the difference for this? I can tell you what is the difference between regular facials and medifacials.
Yes.
In regular facials, they use D10 and bleach, and then they use certain creams and scrubs and massage on your face, and that is the facial that parlor person does. They put steam and then they meticulously clean your pores and everything. In Medifacials, we have a combination of medical treatments
Okay.
in
Okay.
a cocktail of medical treatments
Okay.
that gives you a good glow, a healthier skin.
Okay.
So that is called Medifacials.
Right. And what, according to you, is a safer option for the hair removal? Like, is it waxing? Is it threading? Is it, of course, laser treatment?
Yes.
Yeah, but how can you differentiate, and what can you advise on it? Like, what's your take on those?
So each treatment is, there's no harm in waxing unless until you are doing it a proper way and a proper place.
Okay.
I have got few patients who have end up burning their skin with a black mark and red mark they have turned up. So if you're putting extremely hot substance on your skin, you are damaging your skin, right?
Okay.
So, and then it is too painful also.
True.
Yeah, so it clearly depends on what you are comfortable with. Shaving is always a good option.
Okay.
It's a myth that shaving leads to a thicker hair growth. No, it does not lead to a thicker hair growth at all.
Okay.
So shaving can be done, threading can be done, but then again threading people end up with cuts and everything also.
True.
So whichever works with you is
Go
okay.
for that.
Yeah, you
Yeah.
can go for that.
And also, does it disturb your hair cycle? Because I've heard this, that when you wax your, when your skin, it disturbs your hair growth cycle and it interrupts. Is it like aisa kuch?
No, there is nothing. Who cares about your hair growth cycles of your hair?
That's
of
true.
your hand. If it is coming, new hair are coming in 15 days instead of 20 days. Do you really care?
Right. And what about laser treatment? Like,
Lasers are the safest and best option if you ask me, because it is pain free. And then once you are done with laser, you get so much of hair reduction there. Practically you can go without doing any sort of treatments after that. Then you don't require shaving or waxing or threading. You are
Hassle free.
Yeah, hassle free. So it is one of the safest options.
okay, and how long does it take you to go again and have your laser treatment? Like, what's the duration?
So laser is done once a month.
Okay.
Okay, you require approximately 6 to 7 sessions minimum for most of them. Then some do require maintenance sessions, some do not require maintenance sessions.
Okay.
So after that, like if it is hair reduction, see, it is not hair removal. You cannot expect all your hair are gone. But then few 2-3 hair here and there are left behind.
Yeah,
Whatever
that-
hair that are there, they have got very fine, then they are not visible.
Okay.
So you can just leave it as it is. You don't need to, wax or shave after it. So
And like, with time, does it remove permanently? Like, for example, if I have gone through laser treatment for years now, that's my question. It might be a dumb one, but
no questions are dumb.
but that might, I wonder sometimes, कि with time, it might happen that I have no hair growth. Does it happen? Like, or you have to continue?
No. There's no hair growth. As I said, it's hair reduction, not removal.
Okay.
So, see, let's say for your understanding, can you see hair on my arms?
No, I can't.
Yeah, if you examine it closely, you'll see a few hair here and there.
Okay.
So it's gonna be lifelong like this. And then over a period of time, you'll see all your daddies would have practically hairless hands, because it's gonna shed off a little. So over a period of time, yeah. But then talking about young age, then once it is gone, it's gone, unless until you have some major hormonal imbalance,
Right.
or changes in your body, then it might come back.
Right.
But apart from that, once done is done.
Done. Okay. Okay.
Once done is done.
So, what is lip filter or lip transformation? Like,
Lip filler.
yeah, filler. Sorry.
Yeah. Lip filler, lip fillers are fillers, hyaluronic acid. So we have temporary dermal fillers, which is basically hyaluronic acids.
Okay.
Okay. Hyaluronic acids is a compound sugar that's found in your body. So that is injected at the site for increasing volume of the lips, having a proper defined outline of your lips.
Right.
So that is done. That is lip fillers basically.
Okay. So
you can have a desired, say like, if you look at my lips, you'll see my upper lip is smaller than my lower lip.
Okay. Yes.
So I can have lip fillers which will enhance this body of the lip and the outlines of the lips. So I'll have a fuller upper lip.
Yeah, it will balance it out.
Yes. So
Okay. Now, what is HIFU and thread lifting. Like
HIFU.
HIFU. Okay.
HIFU is high intensity focused ultrasound.
Okay.
That's a machine treatment. As I said, it's an focused ultrasound waves used to lift the collagen.
Okay.
So we have a collagen layer beneath our skin,
Okay.
which holds our skin uptight. As we
Okay.
age, the collagen gets diminished. The collagen, it is basically collagen. You can think of it as an elastic sheet.
Okay.
Okay, which holds the skin up tight over here. But as we age, the elasticity of that decreases.
Yeah.
So your skin sags down.
Okay.
With that, with the HIFU machine, we can again tighten it back.
Okay.
But all those treatments are temporary. It
Okay.
stays for 6 months, 8 months, then you have to again
Yeah,
do
yeah.
it.
That I was
Yes.
about to ask that. Even for the lip fillers,
Lip
or
fillers.
this one,
Yes.
HIFU.
The dermal fillers, all the dermal fillers.
Okay.
There are silicone dermal fillers as well.
Okay.
That you put it and then you can keep it for few years and then you have to remove it, because anything you cannot keep it for very long.
Okay.
Even if so, that is there. But most of the facial fillers are dermal fillers of hyaluronic dermal fillers. So that hyaluronic acid gets dissolved on its own.
And silicone doesn't.
Silicone doesn't. You have to remove the silicone fillers.
Oh.
Yeah. So dermal fillers are hyaluronic.
Silicone doesn't require any maintenance as such, like.
No, but then after few years you need to remove it, and because it's a foreign object inside your body.
Okay.
There are chances of having cancer in that region.
Oh.
Yeah.
Oh.
So you would have heard so many why does breast implants lead to cancer?
Right.
Silicone implants, when placed in your body, it's a foreign object. It's gonna keep on attacking there, keep on growing a protective wall around it to protect the body from it. So
Right.
hence leading to cancer.
Okay. Yeah, that's my next question. Recently an actor named Chetna Raj,
Yes.
died because of liposuction.
Yes.
So what's your take on it? I really want to know, like, how.
So liposuction again, any surgery has complications.
Okay.
Any surgery comes with its fair shares of side effect. It has its own risks. Liposuction is something which, if you want to do, it has to be done from a very experienced, trained, well-set clinic, hospital. Okay.
Okay.
Because her death could have happened because of n number of things from this.
True.
Maybe infection, sepsis.
True.
Infection could have happened post-surgical, because of the environment, or if the instruments used were not clean enough, or something could have gone wrong and infection could have happened. A healthy organ could have been perforated while liposuction. You know how liposuction is done? The procedure?
No.
They have this long needles,
Okay.
which is poked inside your body in whatever area that you want to do, and from that the fat is been sucked out.
Oh.
So it has to be like continuous poking like this.
Oh my God.
So while doing that, if it's an inexperienced doctor, he or she can perforate a vital organ.
So it's liposuction, not liposuction.
Yeah, it's liposuction.
It's liposuction.
Yeah.
Okay.
So
Oh my God. So it's
it can
it's about.
perforate a healthy organ and you can die. It can also lead to, because after the procedure you can't move around a lot, it can lead to pulmonary embolism. A fat cell would travel to your lungs and stick there and you can't breathe. It can lead to deep vein thrombosis. It can lead to multiple reasons. Multiple things can go wrong. Your fluid imbalance could happen because a lot of fluid loss and changes goes during that treatment. A lot of electro imbalance happens. You can go into electrolytic shock and she could have died. Multiple things could have happened. Either of one could have happened. There are n number of things that could go wrong. Hence, you need to go to a proper, experienced, certified doctor who has a proper, well set up clinic.
Right. And it's all about reduction for fat, right?
Yeah, it's all for fat reduction.
Okay.
You might look at it as, for an actor, it is, she has to look good in front of the camera. So
Right.
She did it.
Right. Okay. So now as we are coming to the end, do you want to convey anything to the audience, like any specific views you want to share?
No, I mean, not particular thing, but I would like to address everybody that don't get too much influenced by your outer looks. You know, healthy
Yeah.
ladies are the prettiest.
True.
Healthy people are the prettiest. Be happy from your heart, and it is always shown on your skin.
And irrespective of your body type.
Yeah. Because in today's generation, people are made too much aware, too much conscious about their body type. Don't let that affect you.
True.
Everybody is different, every body is different, and every body is well appreciated.
Right.
God has created that body type for a reason.
Yeah.
So you are, as long as you are healthy, you are fit.
Right.
You don't need to change your body type. You don't need to get into those skinny pants. It's okay. It's absolutely okay.
Right.
If you have a few weight, few fat over here and there, it's okay.
Yeah.
As long as you are confident enough,
True.
you can pull anything. It's
Yeah.
all about your confidence, and your confidence comes when you love yourself, when you look yourself in the mirror and confident. That confidence reflects when somebody else sees you.
True.
Right. For that matter, I'm not a fan of Kareena Kapoor.
Okay.
But she's a very confident lady. Okay.
Right.
When you look at her, no matter whatever her body type is, and she usually dresses up in casual,
Yes.
but still people look at her as an icon.
Right.
The reason behind is her confidence.
Yeah. True.
Priyanka Chopra is also a very confident person,
lady, yeah.
but then she always carries herself very nicely. You'd hardly see her in casuals.
Right.
So her confidence comes with a reason, and she
Yeah.
dresses that way. But I don't know where the confidence from Kareena Kapoor comes. God only knows. But then she's a very casual person. She dresses very casually, but then
Right.
that confidence shows in her attire.
Right.
So it's about believing in yourself, loving yourself, and being confident in who you are. Then no matter whatever you dress, however your skin, hair is, you're gonna end up looking good.
Yeah, I've recently read this thing. I'm not like precisely differentiating men and women. Of course, men do have their own insecurities. Yeah, but I read this that I've never heard a woman say that I love my body.
Yeah.
So I'll make sure that if someday I become a mother, I'll tell my daughter that I'm proud of myself, my body, so she knows.
Yes.
That's all. She knows that what confidence is, what loving yourself is.
Yes.
So yeah, I really it impressed me a lot. Like yes, it's
Raising, so now what I believe is raising strong women is what we should
yeah.
be doing, and all those boy moms, we should be raising boys who would respect the woman in a right
Yes.
way, who would
Yes.
compliment her in the
Yes.
right way.
yeah, and it goes hand in hand. Like boys respecting girls, girls respecting boys.
Yes.
It's that is what we call feminism. It's not
Yes.
only about women.
Yeah,
it's about equality.
The feminism started at a very right point, but from my point of view, where it is going, it's all turning into a fake feminism.
Yeah, true.
Yeah,
True.
I'm not with the woke feminism that is going on
Yeah.
right now. I am a feminist,
Yeah.
but I'm not the current feminist that people, have that opinions about.
With my point of view, there is only one feminism. Like there is only one definition to it. Like that is equality. Girls respecting boys,
Yeah.
boys respecting girls.
Rather than equality, again, I might end up getting a lot of hate, but you cannot have equality from boy and girl. I mean,
not
they
as-
are different. Yes.
Yeah,
but that's where it is going right now.
Yeah.
They want equality in everything.
Yeah.
Equality should be there in terms of respect.
Right.
Equality should be there in terms of opportunities.
Right.
Equality should be there in terms of helping each other out.
Right.
That is where the equality is needed.
Yeah.
But right now, in the name of equality, the women have lost their feminism, and the guys have lost their gentlemanness.
Yes.
That is sad.
Yes. I think this is a never-ending talk.
Yeah.
We'll surely have off camera.
Most certainly.